In this video, we will discuss about the treatment of tuberculosis. The treatment is divided into four categories, so we will cover each category subsequently. So, starting from the category one, first of all, the indications of what patients fall into category one. So, first of all, is if the patient has the neo smear as positive for pulmonary tuberculosis. If the smear is negative in pulmonary tuberculosis, but however, there is an involvement of extrapulmonary involvement. All right. Now also new cases of pulmonary tuberculosis. Now coming on to the treatment. Now in treatment, we divide the treatment into two phases. One is the initial phase and the second one is the continuation phase. So in the initial phase, and this is the continuation phase. Now in the initial phase, what we will give is we will give 2 EHRZ, or we will give 2 SHRZE. All right. In this we will give HE, then HR, and H3 R3 for H3. Now to know what all these alphabets stand for, I'll just tell you in brief. You can refer to pharma for the complete mechanism. So first of all, I'll just sum up. So H basically stands for isoniazid. Then R stands for rifampicin. Then Z stands for pyrizinamide. E stands for ethambutol. And S stands for streptomycin. All right. Now coming on to the treatment. First, here we have EHRZ, SHRZ. Just remember, in category 1 you will basically have maximum of 4 drugs, okay, not 5. Okay, just remember this much. Too easy to remember, what you do is you just add 333 here. All right, so E3, H3, R3, Z3. Okay, then we come to the 2-month sputum. Now if the sputum is positive or negative, that will decide the further course. Now if it is negative, then we will give continuation phase. Okay, now if it is positive, then what we will do is we will extend these 4 drugs for 1 month, 1 more month. Okay, then what we will do is we will give continuation phase for 2 months. All right, for 2 months. Now after this, what we will do is we will take the 5 months sputum. Now in 5 months sputum, if it is negative, then it means that we will refer back to the continuation phase. All right, and if it is positive, it means that the patient has to be shifted into the category 2. All right, now I'll just sum up again. In category 1, what are the indications? If there is a patient of pulmonary tuberculosis who has a smear positive. Second, if there is negative smear but he has extrapulmonary involvement. And third, if there is some new case of pulmonary tuberculosis. All right, now we divide the treatment into two phases, initial phase and the continuous phase. Now for the category 1, always remember there will be only 4 drugs. Okay, so basically you need to remember this. An easy way to remember it is just remember HRZ as being the staple drug and interchange E with S. All right, then just add 333 in front and 2 over here. Okay, then over here what you need to do is just similarly just remember H as staple, HEHRHR3, add 3. Just remember 6 and 4 here. Then 2 months sputum, then positive and negative. If it is positive, then you have to extend all these 4 drugs for 1 more month, and then you do the continuation phase for 2 months, and then you collect the 5 months sputum, and if it is negative, then continuation phase. If it is positive, then shift the patient to the category 2. Now coming on to category 2. Now it seems like category 2 might be more severe because we are shifting the positive patient into the category 2. Now category 2 is basically when there is the sputum positive case in the category 1. Okay, also if there is some relapse or there is failure or there has been some error, that is, it is defaulter. Okay, so similarly just divide it into initial phase and a continuation phase. Now here I want you to remember is in category 2 what you will have is you will have 5 drugs. All right, so just write all the drugs once, SHRZE. Okay, then just remove the S, then just write HRZE. Write 2 here plus here 1 here. All right, then just add 3 to all of them, R3, Z3, E3, and then 1 H3, R3, Z3, E3. Now in continuation phase you will have around 3 drugs. Okay, so Just remember HRE and HRE. Okay, this is 5 and this is 1. Okay, so this is it. Now what you will do is, again, 3 months sputum over there. If you remember, it was 2 months sputum, right? But in category 2, what we do is we take 3 months sputum. Now if it is negative, then we pertain to the continuation phase. Now in case if it is positive, then what we will do is we will extend the 4 drugs for 1 more month. Now there we were taking a 4 month sputum, and here there we were taking a 2 month sputum, and here we will take the 4 month sputum. So then 4 month sputum, just remember that you are basically doubling everything. So 2 here, then 4 here. Okay, then there were 4 drugs, here there are 5 drugs. Then in the continuation phase there were 2, here there are 3 drugs. Just remember this way. Also 4 month sputum. Now if it is negative, that means there is continuation phase. Now if it is positive, it means that we need to do the culture and sensitivity test. Then what we will see is there is resistant to 2 or more the staple drugs that we are giving, the tuberculosis drugs for continuation phase. Now what we will see is, we will see that it is a resistant case of tuberculosis. So in this we have to give second line of tubercular anti-tubercular drugs. Okay, so this is the category 2. To sum up, if there is a sputum positive case in the category 1, we shift the patient into category 2, and if there is a case of relapse or failure or a defaulter smear, so the patient is shifted to the category 2. Now initial phase and continuation phase, there I want you to remember there are 4 drugs, but here there are 5 drugs. Okay, and here there are 3 drugs. Now since, just remember this way, if there are 3 drugs here, so 3 months sputum here. If there are two drugs here, then 2 months sputum here. It is an easy way to remember. Okay, then if it is negative continuation, whenever it is negative, just refer to the continuation phase. Now similarly here, refer 4 drugs again for 1 more month, and then over there it was 2 months, here it is 4 months sputum. Now if it is positive, then culture and sensitivity, you will find that the patient is resistant, having a resistant tuberculosis. Okay, now coming on to the category 3. Category 3 is a mild category. Over here what you will see is, you will not see pulmonary tuberculosis, but you will see an extrapulmonary involvement. Okay, it is a less severe form. So the indications are, it is the new smear negative tuberculosis. Also it is a mild or less severe form of extrapulmonary tuberculosis. Now here similarly, just divided into an initial phase and a continuation phase. Now here 4 either than 5 drugs. Now here remember 3 drugs, third category 3 drugs. Okay, HRZ and HRZ again. So 2 here, 2 here, 3, 3, 3. Just remember this way. Then just do the same thing as in category 1, 2 drugs in continuation phase. So HE, HR, then 4, add 4 again, then 4 H3, R3. Okay, then what we do is we give 2 months sputum. Same thing as in category 1, we don't give 2 months sputum, we actually take 2 months sputum. Then negative and positive. If it is negative, similarly continuation. Now if it is positive, there are 2 possibilities. Either what happened was that the smear patient, the smear positive patient, he had been misdiagnosed. Okay, also it can be that if the patient was smear negative initially, he became a smear positive patient during the treatment. Okay, so this is it. Then we will shift this patient to category 2. Okay, now coming on to the category 4. Category 4 is basically you are going to give second line of drugs. Okay, so in this is basically initial phase and a continuation phase. It is easy to remember and a different thing, so you will recall it better. So what you do is, you just write 6 line here, then you give kanamycin, ofloxacin, cyclosporin, and ethambutol, also pyrazinamide, and there is one more drug that you give here. I just can't remember it. Yeah, ethambutol. This is ethosuximide. Yes. So this is the initial phase, and in the continuation phase, just remember, write 18 over here, ofloxacin, ethosuximide, ethonamide. Yeah. So cycloserine and ethambutol. Then this is the multi-drug resistant tuberculosis that we refer to in the category 2. Okay, now to sum up, I'll just do it again. First of all, what we have is category 1. So in category 1, what you need to remember is the positive patient of pulmonary tuberculosis, either he is negative, having an extrapulmonary involvement, or it is a new case of pulmonary tuberculosis. Then in initial phase, just remember, there will be 4 drugs. In continuation phase, there will be 2 drugs. Now, in comparison to category 2, what you will see is, this is 4. In category 2, there are 5. Okay, and in category 3, there are 3. Okay, over here there are 2. In that category 2 it will be 3, and in the category 3 again there will be 2. Okay, so 2 months sputum, there we take 4 month, and in the category 3 we take 2 month again. Okay, so basically 2 4 2. Now it's 4 drugs in every. Okay, so 1 month, so continuation 5 months sputum, and then we see that the patient is positive, so shifted to the category 2. Now category 2 similarly, first indication from the last category, and then if it is relapse, 5 drugs, then 3 drugs, 3 months sputum, 4 months sputum, and then it is done. Okay, there 2 month are here 4. Okay, so in category 3 what you see is, if there is negative, if there is basically extrapulmonary involvement, it is less severe, so 3 drugs and 2 drugs and then 1 sputum. Okay, now two possibilities: either the patient has been misdiagnosed or the patient has gained the tuberculosis, and then the patient is shifted to the category 2. This is important. Now in category 4 what you see is second line of drugs basically given in multi-drug resistant tuberculosis. Just remember the drugs. I'll just sum up the names again. So KM stands for kanamycin, OFX stands for ofloxacin, CS stands for cycloserine, ETO stands for ethonamide, E stands for ethambutol. I think I've covered all. Z stands for pyrazinamide. Pyrazinamide. It is a first line drug as well. So this completes the treatment of tuberculosis. I hope you understood.